Wyoming medical professionals are urging state lawmakers to act before it's too late to take advantage of a pandemic-related financial incentive for expanding Medicaid coverage. The American Rescue Plan would bring an additional $54 million into state coffers to pay for expansion, but also to invest in priorities including education and infrastructure. Jan Cartwright with the Wyoming Primary Care Association says in addition to giving up to 24,000 people access to health insurance, the move would provide some relief for the state's budget.
When you have more people in the health insurance pool, everybody's more healthy. So I think it's a Wyoming value that we see more people having access to health care, which really increases productivity. It increases the ability of families to thrive.
A recent Joint Revenue Committee-sponsored bill would give Governor Mark Gordon permission to discuss options for expansion with the Centers for Medicare and Medicaid Services. Opponents have long argued that Wyoming doesn't need federal assistance to take care of its residents and warned that the state would be on the hook for additional costs if the Affordable Care Act is ever dismantled. Cartwright notes roughly 70% of the people who would qualify for expanded coverage already have at least one job, but they work in sectors that don't provide health benefits. She points to data showing expansion would also improve health outcomes for mothers and infants.
About half of the new enrollees, if we were to expand Medicaid, are working women under the age of 35. And right now, our state has one of the nation's highest uninsured rates for women of childbearing age.
Proponents also say hospitals, frequently the largest employers in rural areas, would benefit from expansion because they wouldn't be stuck with millions of dollars in uncompensated care costs when patients without coverage can't pay their bills. Cartwright says people with insurance are also more likely to seek preventative care, which would mean fewer costly trips to the emergency room.
We know that the emergency room is the most costly way to seek health care, and a lot of people who do not have health insurance end up in the emergency room. Medicaid expansion would really support the entire healthcare system.
This is Eric Galatis reporting for the Wyoming News Service at publicnewsservice.org.